Hello. Today, in clinical practice, CT and MRA can only perform morphologic evaluation of the aortic dissection. It's a pity because we need a dynamic evaluation if we want to improve the management of the serious pathology. We're talking about 20% mortality at 30 days. So we hypothesize that 4D-Flow was able to realize this dynamic evaluation. That's why we realized our question was, is 4D-Flow is able to evaluate the impact of the endovascular treatment on the hemodynamic of the aorta and its branch. For that, we use evaluation criteria. We measure the flow in the true lumen, the false lumen, in the aortic branch, and through intimal tears before and after the endovascular treatment. And also we look at the shear force and try to identify helicoidal flow. Here is an example of a 70-year-old man who had an aneurysmal evolution 12 years after an uncomplicated type B aortic dissection. We performed the first MRI, and you can see also here a helicoidal flow in the false lumen. It was the same for all the patients in preoperative MRI. Then we performed the endoprosthesis implantation. As you can see, there is aliasing due to the stent in the descending aorta. And we measure the flow. In the true lumen, we show an increased flow, and in the false lumen, we show a decreased flow. It shows a good implantation of the endoprosthesis. We also measure the similar value in the stent and downstream the stent. It is very important because it shows the reliability of our measure. As none of our patients had malperfusion syndrome, we didn't measure variation of the flow between the two MRI. It's very important because in case of primary anterior closure, we decrease the flow in the false lumen, and we can create malperfusion syndrome. So it's important in clinical practice. We also identify a helicoidal flow downstream the stent for one patient you can see here on the right. It's important because helicoidal flow is a known risk factor for aneurysmal evolution. Finally, for the fast contrast, MRI was able to perform quantitative and qualitative evaluation of the flow in dissected aorta before and after endovascular treatment. 4D-Flow, by performing an early hemodynamic evaluation of the aorta, might be helpful in the management of the aortic dissection. Thank you. Go to see Christopher.